Welcome to Weekly Neurology Deep Dive. Before we get started, just a reminder that this deep dive is purely for educational purposes. No commercial interests here. We're bringing you a neurologist-focused overview of a recent paper, but always good to refer to the full research for a complete picture.
Absolutely.
Today we're diving into, this one's got a long title, Association of Year-to-Year Lipid Variability with Risk of Cognitive Decline and Dementia in Community-Dwelling Older Adults.
Quite a mouthful.
Definitely.
But the findings are definitely worth a closer look. Could really change how we approach dementia risk.
Really? In what way? What's got everyone talking about this paper?
Well, it seems like, those fluctuations we see in our patients' cholesterol levels?
Mm-hmm.
The study's suggesting those might be a bigger red flag for dementia than we initially thought.
So it's not just about having high cholesterol per se.
Right. It's not just about the numbers being high. It's more about how much those numbers change over time, year to year.
Interesting. So where did they get the data for this?
They used data from the ACE-TA trial
Okay.
and its extension, ACE-PRESTT.
Got it.
So we're talking almost 10,000 participants.
Wow.
Healthy older adults, by the way. No dementia, no major cognitive issues at the start. They were followed for up to 11 years.
Oh, wow. So they had annual blood tests?
Yep, annual blood tests, regular cognitive assessments, the whole 9 yards.
So they really got to see the long-term trends, not just a single snapshot in time.
Exactly. They weren't just looking at one point in time. It was all about the trends. Specifically, they were really interested in the variability of total cholesterol,
Okay.
TC, and then also low-density lipoprotein cholesterol.
LDLC.
You got it.
So when we talk about variability, what does that mean? How do they actually measure that?
Well, they used a calculation. It's called variability independent of the mean.
Catchy.
VIM, for short.
Okay.
And basically what this does is it allows them to really isolate the impact of the fluctuations themselves.
Yeah.
So not just looking at, a high average cholesterol. Imagine you have 2 patients.
Okay.
Same average cholesterol over, say, a few years. But one has really stable levels.
Uh-huh.
The other one's all over the place, up and down, up and down.
Right.
This study is saying, hey, that patient with those fluctuating levels might need a little more attention, even if their average looks okay on paper.
That's a really crucial point, especially for us as neurologists. In our practice, we often get fixated on those average numbers.
Yeah.
This study is kind of pushing us to pay attention to those swings, too, the ups and downs.
Exactly. Think of it like almost like a whole new risk factor.
Interesting.
And the results back this up, too. The people in the study, the participants with those dramatic cholesterol swings.
The ones in the highest quartile of TC and LDLC variability.
You know it. They had a much higher risk of developing dementia. Significantly higher.
What kind of numbers are we talking about here?
Okay, so those with the highest TC variability, 60% higher risk of dementia compared to the folks with the most stable cholesterol levels.
60%. That's a pretty big jump.
It is, and similar trends popped up for CIND, too.
Cognitive impairment, no dementia.
That's the one. So, yeah, it really does make you think about the impact cholesterol variability could be having on, cognitive health.
Definitely. Makes you wonder why. Why does this variability seem to be so harmful to the brain?
Well, that's the big question, isn't it? And the study offers a few possible explanations. They think those cholesterol swings might be messing with the brain in a couple of ways.
Let's hear them.
Okay, so first, think blood vessel damage.
Okay.
Imagine those fluctuating levels are like little tiny earthquakes.
Earthquakes.
Yeah, just constantly shaking those delicate blood vessels in the brain.
Oh, I see what you mean.
And over time, that kind of shaking could lead to damage, damage that could contribute to cognitive decline.
That's a powerful image. What's the second way?
Inflammation, chronic inflammation. So cholesterol variability might be like fueling the fire of inflammation in the brain.
And we know chronic inflammation is a major player when it comes to cognitive problems.
Exactly. So we're talking about 2 potential hits to the brain, maybe even working together. Blood vessel damage and inflammation, both possibly triggered by those cholesterol ups and downs.
Not a great combination.
Not at all. And there are a few other interesting tidbits from the study that I think are worth mentioning.
I'm all ears.
All right, so while TC and LDLC variability were really strongly tied to dementia risk, high-density lipoprotein cholesterol,
HDLC.
right, HBLC,
XF.
and triglyceride variability, they didn't seem to have that same strong connection.
Interesting. So maybe TC and LDLC variability are the ones to watch out for. at least when it comes to dementia.
Seems that way. Now, here's another one, and I think this is something a lot of neurologists will be interested in. They looked at the impact of medication
Oh,
adjustments.
yeah, that's a good point. A lot of our patients are on lipid-lowering medications.
Right. So they compared people who switched their medications during the study to those who stayed on a consistent regimen. And get this, the lipid variability in that medication switching group, it wasn't linked to dementia or cognitive decline.
Huh. So maybe those fluctuations we see when people adjust their medications, maybe those aren't as worrisome as the natural cholesterol swings.
That's what it looks like. Now, obviously, we need more research to, really nail down exactly how cholesterol variability impacts the brain
Of course.
and to confirm all these findings. But I think the study gives us a whole new way of looking at dementia risk. Could even change how we approach prevention and treatment.
Absolutely.
Yeah. It's important to mention, though, every study has its
Of
limitations.
course. What are some of the limitations we should keep in mind with this particular study?
So one thing to consider, even though they excluded participants who started or stopped lipid-lowering meds during that 3-year variability assessment,
Right.
there's still a chance that some of those variations were due to things like maybe people not taking their medications as prescribed.
Non-adherence.
Exactly, or, dosage changes. So we can't be 100% certain if the fluctuations we're seeing are just the natural course of things.
Or if medication adherence is playing a role.
Right, and this really highlights, how important patient education is, making sure our patients really understand they gotta take their meds as prescribed.
Absolutely. Any other limitations worth noting?
Another point to remember is, clinical trials like ASPIR, they tend to enroll folks who are generally healthier.
Right. Not necessarily representative of the general population.
Exactly. So in this study, participants had a lower burden of frailty, morbidity, polypharmacy, that kind of thing, compared to what we might typically see in our practices.
Yeah, dealing with more complex patients.
Mm.
So we have to be careful about generalizing these findings to all older adults.
Right. It might not apply in the same way to those patients who have multiple health issues, taking a lot of different medications.
Makes sense. What else? Any other limitations?
We also need to think about the possibility of a reverse causation.
Reverse causation, meaning,
Could it be that the cognitive decline is actually driving the cholesterol fluctuations instead of the other way around?
that's an interesting thought. Did they address that at all in the study?
Well, we can't completely rule it out, but they did try to minimize that possibility. They excluded anyone with a history of dementia,
Okay.
and they gave everyone cognitive tests at the beginning to rule out any pre-existing cognitive impairment.
So they tried to control for those factors as much as possible.
Yes, and they also adjusted for a whole bunch of other potential confounders, age, sex, race, BMI, smoking, alcohol, education level, blood pressure, diabetes, chronic kidney disease, family history of dementia, frailty, use of other medications, the whole shebang.
Sounds like they were pretty thorough.
They were.
Yeah.
But, it's an observational study, so we can't definitively say this causes that.
Right. Correlation, not causation.
Exactly. We need more research, ideally, randomized controlled trials, to really confirm these findings and figure out what's really going on.
So while this study is interesting and gives us a new perspective, we need more data before we can draw any firm conclusions.
I think that's fair to say. But even with these limitations, there are some real strengths to this study.
Oh, okay. What would you say are the biggest strengths?
Well, for one, they used lipid data from 4 different points in time.
Okay.
So they could really see how those cholesterol levels were fluctuating over time, not just relying on a single measurement.
Which wouldn't tell the whole story.
Nope. And they specifically looked at year-to-year variability over that fixed 3-year period, which makes the comparisons between participants, more robust, plus the sheer size of SPE.
Almost 10,000 participants.
Exactly.
Right.
And the way they collected the data so carefully and how they diagnosed dementia cases, it all adds weight to the findings.
So, despite the limitations, it sounds like a well-designed study that contributes meaningfully to our understanding of dementia risk.
I think so. And it has some potentially significant implications for how we practice, too. Could change how we think about dementia risk assessment and management.
That brings us to the big question then.
Yeah.
What do we do with this information? How can neurologists like us actually use these findings in our day-to-day practice?
Well, it definitely opens up a whole new area for us to explore. We need more research to, see if these findings hold true in other groups of people.
Different populations.
Yeah, and we need to figure out the best way to measure and track cholesterol variability in a practical way.
Something we can actually use in the clinic.
Exactly. And then there's the question of treatment strategies. What can we actually do to manage this variability and hopefully reduce dementia risk?
That's the key.
Now, this study didn't specifically look at interventions, but it hints at some areas we need to investigate further. Like, can lifestyle changes like diet and exercise actually make a difference in cholesterol variability?
That's a good question. And what about medications?
Hmm.
Specifically statins. They're our go-to for managing cholesterol.
Right. Now, remember, they found no link between variability and dementia in the group that changed their lipid-lowering meds. But that doesn't mean statins aren't important. It just suggests that maybe those natural cholesterol swings, they might be the bigger issue.
More so than the fluctuations caused by adjusting medications.
Right. But again, we need more research to really understand the role of statins and other lipid-lowering medications. Can they actually help reduce the risk associated with variability?
So there's still a lot to learn about how to manage this new risk factor.
Definitely. But this study is a great first step. It's gotten us thinking about cholesterol variability in a whole new way, and that's exciting.
Absolutely.
Yeah,
It really makes you appreciate just how complex the brain is.
it does.
All these different factors that can contribute to cognitive decline.
Yeah. And we've come a long way in understanding dementia,
Uh-huh.
but this study just shows we still have so much more to learn.
It's true.
Research like this is so important, though.
Absolutely.
It gets us closer to, really understanding what causes this devastating disease. And hopefully, one day, finding a cure.
So as we wrap up this deep dive, what's the one key takeaway you want our listeners to walk away with?
I'd say pay attention to cholesterol variability in your older patients, especially when you're thinking about their risk for dementia. It might be time for us to shift our perspective a bit.
In what way?
Instead of just looking at the average cholesterol level, let's start thinking about those fluctuations over time.
So not just a snapshot. We need the whole picture.
Exactly. It's like instead of just seeing one frame of the movie, we need to watch the whole film.
I like that analogy.
It really could change how we approach prevention and, early intervention.
Well, thank you so much for breaking down this research for us.
You're welcome.
Really interesting stuff. And to our listeners, thank you for joining us for another episode of Weekly Neurology Deep Dive.
Always a pleasure.
And as always, this was just a brief overview, so be sure to read the full paper to get all the details. Until next time, keep those brains engaged.
And those cholesterol levels steady.